A lot of patients ask us, what does a skin cancer look like? How do I know if I've got skin cancer? How do I know the spot's not skin cancer? That's a tricky question. That's why we go to school for 14 years after high school to learn these things and to try to figure this out. But there are some general guidelines I give patients. One of the things I hear most often is a patient will come in and they say, this is the first time I've had skin cancer. I had this spot that came up on my nose and I thought it was just a pimple, but it stuck around for 4 weeks, then for 4 months, and then several months, and the spot kept getting bigger and it didn't go away. And so that's one thing I do tell patients a lot of times. If you have a new spot that's growing or changing, especially something that looks like a pimple on your face and it's not going away, that's something that's sort of, sound a little alarm bell in your mind and prompt you to consider getting checked. The difficult thing with diagnosing skin cancer is that there are different types of skin cancer, and even the same type of skin cancer can look different and be in a different shape or form. The same type of cancer, a basal cell cancer, for example. Sometimes a basal cell cancer can have a classic dome-shaped appearance. It's translucent and it bleeds easily. That's a very classic look, a little dome-shaped papule. But also basal cell cancer can sometimes present as what appears to be a white scar. Sometimes it can appear as a red scaly patch. So even the same type of cancer can sometimes present with a different clinical picture. As a patient, we would never expect you to be able to diagnose yourself, and that's why we're here, to check you and to help make sure that you don't miss something. When it comes to skin cancer prevention, there's a couple things I recommend patients do. One is checking yourself on a regular basis. So, especially if you're a higher risk patient, take the time to at least check yourself over in the mirror once a month. Don't do it every day. You'll drive yourself crazy if you do, and it's really hard to see if things change from day to day. But once a month, check yourself over. Number two, if you're a high-risk patient, consider having somebody take pictures of your body, maybe a husband, a spouse, or a friend, and you can keep those on your own computer at home encrypted. And that way, if you see something change, you've got sort of a baseline to work from. And number three is to make sure you get checked by a specialist on a regular basis, because there's things that we can see and recognize that you might never recognize. How often to get checked is really a matter of how high risk you might be. We typically base it on risk factors such as family history, your own personal history of skin cancer, your history of sun damage and how you've protected your skin. What kind of damage are we seeing on your initial examination? Are we seeing a lot of damage, or does your skin look great? In most patients that are low risk, we might check those patients once a year. Patients that are a little bit higher risk, I would say we more often probably check them every 6 months. And we have some patients that are even higher risk that we'll see every 3 months, depending on how many skin cancers they have.